And I think as healthcare practitioners, we are afraid to load people. And it's partially not our fault because if you think about all the physical therapy clinics that you have seen throughout the country, there's just not enough load, right? Like there's times where I'm working with a football player who's coming off of a meniscectomy, let's say, and he's squatting 300 pounds. For him, that's, I don't know, 65%, 70% of his 1RM. But for me, that's a massive amount of weight. But for him, it's really not. And so as a clinician, it's uncomfortable to prescribe that amount of load, right? So we notoriously in rehab underload our patient, which is a problem, which means then they're not strong enough, which means they can't be powerful enough to do their job, which sets them up for re-injury. So, again, as a healthcare practitioner, I don't have to be the best strength coach in the world, but I have to be able to speak the strength coach's language. I have to be able to regress those things and talk about a smart progression of load and speed and tempo and all of those things and be able to create a program with them to address their physiological limitation, whether it be hypertrophy or whether it be true, absolute strength or relative strength or elastic strength or speed strength or some physical quality that they're lacking. We've got to be able to program that safely together because those are different set rep schemes, those are different tempos, those are different loads, those are different, whatever. So, as clinicians, we don't have to do it all, but we have to be able to, have somebody in our corner that we can have those conversations with.
And at least have an understanding of it. I know it's the human body, the brain always wants to stay comfortable. So it's easy to just stay in your lane.